Is back pain usually related to a spine? This is Dr. Arun Reddy, consultant neurosurgeon and endoscopic spine surgeon at care hospitals everywhere. To know regarding this, they need to understand what are structures that form the spine. Spine has got vertebral column, that is the bony structure, and it has got spinal cord inside with nerves which supply in your lower back as well as our legs in the lower area, and that is protected by muscles as well as it has got cushioning cord disc. Any issues which are related to these things may cause back pain, or these the causes in younger generation, especially in this urban population area. The chances are less, except for if it is involved around the muscle, which is a mechanical back pain, which we usually see because of sedentary life or less profound activity, physical activity that they cater because of their work pattern. Other than this, we also need to understand that stress is also one of the major factor which causes back pain, because during stress the muscle gets strained and it leads to the formation of back pain. And non-spine causes of back pain will be the form of a renal calculi, that is a kidney stone, or a cholelithiasis, which is a gallbladder stone, or something which is related to a pelvic area, that is our hip bone area. These are the unusual causes of non-spine related back pain. Protect your spine so that you would be devoid of your back pain. Now let us understand that what precautions do we need to take to prevent back pains. This especially hits to the entire spectrum of ages, which ranges from young to geriatrics and old age people. Try to make sure that you don't lift heavy weights unless you train yourself properly by doing a regular physical activity. The maximum weight that we usually recommend is around 10 to 15 kilos in a young healthy two hands. Try to be less often to bend forward or squat or sit up. If need to sit down, it would be preferential that sit in a squatting position to lift any objects rather than bending forward. This is what we need to remember. Sitting habit, especially in the people who are more confined to desktop, is most important. Always make sure that you always rest your back, the back of the chair, and your foot is always rested on the ground, so that there is good distribution of central of gravity for the weight, and there is no pressure on our back, which usually takes the tall while standing or sitting without back support. Try to make sure that you take frequent breaks at work. The stretch of the work continuously should be around 30 to 40 minutes. After that, keep an alarm peaked in your mobile phone, which will indicate that you need to take a rest at least for a couple of minutes. Stand, walk. If not, then at least stretch your back and go back to work again. And this is also caters for the neck pain also, that to protect your neck you have to make sure that neck is always neutral. Try to see that your forearms are always rested on the desktop, so that that will take off the stretch pain around your shoulders and neck. And the system as well as the keypad or a laptop should be play a little bit far off, so that the entire forearm is always on the desktop, which will prevent our neck going into spasms because of abnormal postures. Tips that have to be followed back home, especially during sleep, is that you should have proper mattress, which should not be rocky hard or it should not be soft. It should be in between that is firm. Otherwise, it is always preferred to the patient. People do say that soft cushions are comfortable for me. Any mattress that is comfortable to a person, they can be used. Otherwise, we recommend firm mattresses, and always try to make sure that you sleep on the side, then you turn straight so that it doesn't affect your spine. And whenever you get up, turn to a side, then get up. This is the most important thing. Washroom preferential should always be a western washroom, so that you don't squat on the ground, which will take off the pressure from your back. Bathing is always better as a shower bath, or you sit on a stool and make sure that there is bucket filled of water with another stool, which prevents back pain to occur. Healthy diet, that's most important thing. Regular exercises, walking, these all things make sure that your spine health is always maintained.